Singapore healthcare providers must soon contribute to national electronic records. Singapore will introduce a new bill mandating all healthcare providers in the country to contribute to the National Electronic Health Record System, (NEHR). Launched in 2011, the system was developed to create a central database from which clinical summary records from different providers could be stored and shared to facilitate the delivery of healthcare. Singapore looks for answers to key challenges in AI data science. Government unveils a new scheme, investing up to $150 million over 5 years to use artificial intelligence to resolve challenges affecting society, and sets up data science consortium to drive the sector. Read more. Touting the maxim one patient, one health record, the database is owned by the Ministry of Health and managed by its agency Integrated Health Information Systems, (IHS). Data contribution currently is voluntary for private healthcare licensees, and the ministry, over the years, has been encouraging all providers to participate. However, various stats put the figure at fewer than 70 out of the 1,600 GP clinics operating in Singapore today that were part of the NEHR today. More than 1,100 healthcare providers across public and private sectors currently had access to the NEHR, which last month processed more than 1 million patient searches. However, out of the total of more than 4,000 private healthcare providers that included GPs, hospitals, dental clinics, and nursing homes, just 3% contributed to the digital database. And according to an IHS survey, which polled 1,500 of this community, 2 in every 10 private GPs and specialist clinics depended on written health records. In a move to change these stats, Singapore's Ministry of Health would introduce a new healthcare services bill to compel all licensed healthcare providers, including clinical laboratories and private GPs, to contribute data to the NEHR. Expected to be tabled next year, the bill would likely include a 2 or 3 year period during which affected licensees would have to prepare for compliance. The government would be offering assistance to help them get there, including conducting technical workshops and providing online resources to offer advice on how to contribute to the NEHR. In addition, a $20 million grant would be set aside to help healthcare providers and labs defray part of the costs needed to upgrade their systems so these could interoperate with the NEHR. Only early birds, those that contribute data by June 2019, would be given access to such funds in order to encourage early adoption. The government's healthcare agency, IHS, would manage these funds and work with participating healthcare providers. Singapore's Minister for Health Gan Kim Yong said, "Patients can only realize the full potential of the NEHR if the data is comprehensive. And for NEHR data to be comprehensive, every provider and healthcare professional needs to contribute relevant data to it." He added that having access to healthcare records was increasingly important as more patients suffered from multiple medical conditions requiring team-based care. Patients will benefit from the NEHR when their doctors and care teams are able to access their key medical history when necessary and work across settings to provide them with coordinated, holistic, and safer care. This is particularly important during emergencies, Gan said. Commenting on the need to get all healthcare providers on board the NEHR, the Health Ministry's CIO and IHS CEO Bruce Liang noted, "This will not be an easy journey. The state of adoption is uneven across the 4,000 over healthcare institutions in Singapore, and there is a large number of its solution providers with wide variation of offerings. As such, we expect challenges in onboarding all licensees to the NEHR. However, it is a journey we must make as a strong digital backbone is essential in meeting our patients' and healthcare systems needs in the future," Liang added. Noting that the ministry had received feedback on issues such as system security and safeguards, Gan said the government would look at ways to strengthen and refine these. According to the Singapore government, safeguards already were in place to ensure only those providing healthcare had access to patient records, which included information such as medication, allergies, and vaccination history. The records did not include data such as doctors' personal